I want to take care of kids just because I've always liked kids. I mean, it's something I've always enjoyed doing. When I went through my residency program, it was mostly adults, but we did get some exposure to children. And actually one of my, I had a whole year where I did pediatric neurosurgery. And during that time frame, I realized that's what I wanted to do. I knew I always wanted to be a physician. I mean, as long as I can remember, I knew I wanted to be a doctor. It's a great way to help people, and so I knew I wanted to do that. When I went through medical school, I knew I enjoyed doing things with my hands, and so pretty early on I identified I knew I wanted to probably be a surgeon. And it really was one of those just clarity moments where it wasn't during surgery and it wasn't in clinic. It was when we were just doing a consult on a patient, and then going through the exam and how it correlated with what their exam showed, and that correlated with where the lesion was just, I was hooked. I was absolutely hooked right then and there. And then the thought process, well gosh, then I can go operate on that lesion that's causing that problem, was just, I thought that's the coolest thing in the world. And so from then on, I was just, I knew that's what I wanted to do. When I talk to the moms and dads, significant others, that I'm trying to gain their trust. And so letting them know that I care about their child, and I want their child to do well, and I want their child to be better. And so I'm trying to convey that to the families. That's our goal here. It's not cranking out cases. It's not, doing, being the world's expert and so forth. It's really about take care of kids and make them as good as we can be. We just have an extreme advantage that I have tons of neurologists that are available, that are experts in multiple different disease processes. I have partners from our neurosurgeons that each of us have different strengths that we then try to maximize. When we have someone comes in with a new problem, they may come see me even though they really have a problem that one of my partners is better at. And so if that occurs, I evaluate them and immediately say, look, I need to get you someone that's better at this than I am. And so having those functions available to me, having those people there to be able to give expert care and opinions is just invaluable. Absolutely, what I bring my kids to Cook Children's already have, from anywhere from breaking arms to needing tubes in their ears to trauma. One of my girls got rolled by a horse, and so we were in the ER trauma, and one of my girls swallowed something, and we had to go down that route. So absolutely, I would take my kids here in a second, and I already have.